Hello, I'm Darin Gregory, and I have Colleen here with me today, and she's going to talk to you about a recent experience she had. She recently underwent a single-site robotic hysterectomy, and she's going to share some insights about that from a patient perspective. Less on the technical medical aspect and more on how she felt her experience went. So Colleen, did you have any concerns about robotic surgery in general, the fact that I'm not going to be standing there holding the instrument, but it's going to be a piece of technology actually assisting me to perform this surgery?
I did not. That's the way that medicine is headed with technology, and I was really excited that because of the robot I'd have a smaller incision and a faster recovery time. You also gave me a pamphlet. I went home and looked over, and I watched your video on YouTube or on your website and everything, so I was really comfortable with it. Thinking about a hysterectomy for a good solid 2 years since I had my youngest child, and I've been having issues with my period. It's always been on the back of my mind, and once I saw Dr. Gregory and we had a serious conversation about it, I knew it was right for me. I've always had period issues my entire life, well, from 13 on.
Okay.
And just this last 3 years since my last child, and I had tubal ligation and got off birth control, my periods just have been out of control and terrible. I'm a very busy mom. I used to be in the military, and now I'm a stay-at-home mom. I have 6-year-old twins and almost 3-year-old. And we live on a couple acres, and we cut down trees all the time, and we have a small hobby farm, so we have goats and ducks, and I'm always out there feeding them, and we're very active, hiking, and I'm a Girl Scout leader, so I'm very go, 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 go. I chose single-site incision hysterectomy because Dr. Gregory said that I was a great candidate for it. I also spoke with my primary doctor, and he said that that was the best way to go. And I wanted a speedy recovery. There was no way I couldn't have a speedy recovery. I couldn't do a normal hysterectomy with a young child at home. There's no way with the recovery. I also didn't want a large scar on my stomach, so the single site was the best for me. Dr. Gregory did a great job explaining all that was involved with the single site robotic surgery. He explained it in the office. He sent me home with a pamphlet that I looked up their website. I watched his video online. I called him on the phone with a couple of questions I had, and so it was a very calm, relaxing experience with explaining the robot to me.
How are you feeling now that you are 6 weeks post-operation?
I feel awesome. I feel better now than I did before surgery. Second day, the third day, I was feeling good. The incision on the belly button was a little tender, and your insides feel a little bit like a scratchy feeling. Other than that, I was off all pain medications by day 4 or 5, and I was back to myself. I was in the hospital less than 24 hours. I stayed in bed for 1 day after the procedure, and I was around the house that next week, but I was ready at the end of the week to get back hiking and walking around, and my body would tell me if I was doing too much. I went back to driving as soon as I was off all my pain medication. Vacuuming, I stayed away for a little bit, or maybe it was an excuse to get my husband to vacuum more. But about 4 weeks is when Dr. Gregory said that I could start lifting more than 10 pounds, and now I'm back to doing everything. I have a scar from a belly button piercing on the top of my belly button, and after my last pregnancy I had tubal ligation, and so I had about a 1.5 to 2 inch scar about 1 inch below my belly button. And Dr. Gregory, the way that he perform the surgery is he went around that scar tissue and through the scar, and when he stitched it up, he actually stitched it inside my belly button. So I no longer have a scar below my belly button. I still have the one, unfortunately, from my piercing, but the actual belly button looks better now than it did before surgery. I'm very happy I had this surgery, yes.
Okay, and would you recommend it to female family and friends?
I have already recommended it to my sister and a couple of other of my friends, yes.
Well, thank you all, and thank you, Colleen. If you have any concerns about hysterectomy or any other gynecologic needs, or think that a robotic procedure may be the right procedure for you, feel free to check out our website or call our clinic. We'd be happy to see you, talk to you about all your options, and help you find the right treatment for the condition.